crisis doesn't always give you warning. Sometimes life changes in a single moment and you don't know what to do next. One phone call, one diagnosis, one unexpected event, and suddenly the life you knew yesterday is not longer the same. Your mind feels blank. You feel numb. You cannot think clearly. You don't know what decision to make. Not because you are weak, but because you are in crisis. In this video, I'm going to talk about what happens during a sudden emotional crisis, not from a motivational perspective, not from theory alone, but from a clinical and human perspective. I will discuss what a crisis really is, why your mind may feel blocked or confused, what reactions are normal in those first moments, when a crisis may require professional help, and most importantly, what you can do when your life changes suddenly. Because a crisis is not always a mental illness, but a crisis can become the starting point of one. If the stress remains intense, persistent, and unmanaged, it can evolve into conditions such as anxiety, depression, trauma-related disorders, sleep problems, or even substance use disorders. And that's why recognizing a crisis early is not only important, it's preventive. Early recognition and timely support can reduce the risk of more serious mental health conditions developing later. Let me give you an example from my clinical perspective. Two people receive the same news. Both lose their jobs. Both face financial uncertainty. Both suddenly have to rethink their future. One person feels worried but remains able to plan, make decisions, and continue functioning. The other one feels overwhelmed, unable to sleep, unable to think clearly, unable to decide to do next. The event is the same, but the response is different. And the difference is what defines a crisis. This is something many people don't understand. A crisis is not defined by how serious the event looks from the outside. It's defined by what happens inside the person, specifically whether the situation overwhelms their usual ability to cope. Emotional crisis occurs when a person faces a situation that exceeds their normal coping mechanism. Is a state of emotional and psychological overwhelmed. Not simply stress, not simply sadness, but a temporary loss of balance. a moment when the person feels unable to think clearly, decide, or function as they normally would. Let me start by killing a misconception. When most people hear the word crisis, they think of something extreme, a psychiatric emergency, someone being taken away in an ambulance, a complete breakdown. But in psychiatry, we define crisis very differently. A crisis is any situation where a person's usual coping mechanisms are overwhelmed. That's it. That's the definition. Which means a crisis can be losing your job, ending a relationship, a move to other country, a diagnosis, a betrayal, financial collapse. Even I see this more than you will think. A positive life event that you were not emotionally prepared for. The brain doesn't distinguish between a catastrophe and a massive change. It just registers. My tools are not working anymore. To better understand how an emotional crisis can affect the body, let me briefly share a situation from my clinical experience, because many people imagine a crisis also as something purely emotional, but in a reality, a crisis can present with very physical symptoms. Sometimes it can look like even a medical emergency. Let me tell you about one case. I was called to assess a patient in the emergency department. Her name was Laura. She had been admitted after experiencing sudden chest pain, dizziness, and shortness of breath shortly after receiving an unexpected phone call. Her blood pressure was elevated, her heart rate was increased. She reported intense physical discomfort and fear. A full medical evaluation was performed. Cardiac tests were normal. Neurological assessment was normal. There was no evidence of an acute medical condition. Shortly before the onset of the symptoms, she had been informed that recent medical tests confirmed a diagnosis of breast cancer. Her physical collapse occurred within minutes of receiving the news. This was not a heart attack. It was an acute crisis response. Situations like this are more common than many people realize. An emotional shock can trigger immediate physical reactions in the body. Now let's talk about what's actually happening inside you when you are in crisis. Because understanding this is what helps it feel less scary. The moment your brain perceives a serious threat, and the threat can be physical or emotional. It activates your stress response systems. We are talking about the amygdala, the hypothalamus, your HPA axis, the whole alarm network. Cortisol and adrenaline flood your system, and suddenly you might notice your heart is racing, your breathing is shallow, you cannot concentrate, like your thoughts are blocked. You feel physically exhausted, but you cannot sleep. Simply, decisions feel impossible. You might feel detached from your own body, like you are watching yourself from a distance. That last one especially tends to scare people. Am I going crazy? No, that's dissociation. A normal stress response where the brain temporarily buffers, overwhelmed by creating emotional distance. Here, what's important to understand: this is your nervous system doing exactly what it's designed to do. The problem is not that it's activated. The problem is when it can turn off, because when the crisis state becomes prolonged, when you stay in that high alert mode for days, weeks, months, that's when the biology starts doing real damage. Chronic cortisol elevation affects the sleep pattern, immune function, memory and concentration. The hippocampus literally shrinks under chronic stress. There is a mood dysregulation, and that's the bridge I want to build for you today between a normal human crisis and the beginning of a mental health condition. I want to give you a map. Think of it as a spectrum. This is where most people land. Something major happens. You react, you struggle, but with time, support, and coping, you move through it. Duration is key here. In a situational crisis, you start to see stabilization within days to a few weeks. The intensity of the reaction is proportional to what happened. This is grief. This is adjustment. This is being human. In the middle, prolonged crisis response. This is where the alarm system gets stuck. Maybe the stress was severe, maybe there was not enough support, maybe there were vulnerabilities already present. Prior trauma, a history of depression, attachment wounds. The person is not recovering at the expected time. Functioning is significantly impaired. Work, relationships, basic self-care, sleep, they are not eating, they are socially withdrawing. This is not weakness. This is a signal from the body that the crisis has exceeded what the nervous system can resolve on its own. On the other end, crisis as the onset of a psychiatric disorder. And this is the part I need you to hear carefully, because it's where people get missed. Sometimes a crisis, even one with a clear external trigger, is the event that unmasks an underlying vulnerability. Let me give you some examples. A person goes through a breakup. Within 2 weeks, they are not sleeping at all. They feel worthless in a prolonged and global way. Not just about the relationship, everything. They are having thoughts that life is not worth living. That's not a situational crisis. That is a major depressive disorder. A person goes through a high stress period at work. They stop sleeping but feel amazing, more energy than ever. Ideas racing, spending money they don't have even, starting projects at 3 a.m. That stress may have triggered the first episode of bipolar disorder. Someone experiences a traumatic event, not just a difficult one, but something involving real threat. Months later, they are still having nightmares, hypervigilance, emotional numbing. That's PTSD, post-traumatic stress disorder. Sometimes the crisis doesn't cause these disorders, but it opens the door. And the earlier we recognize that the door has opened, the better the outcome. Always. Crisis is not a character flaw, and every single one of us has a treasure. So let's talk about what you can do. Whether you are in a situational crisis or is someone you love going through one. The first thing, name it. This sounds almost too simple, but it matters. When you can say out loud or in writing even, I am in crisis right now. This is a crisis response. My nervous system is overwhelmed. You activate your prefrontal cortex. The thinking brain starts to come back. Naming reduces the sense of a chaos because it gives form to something that felt formless. Second, in crisis, the brain catastrophizes. It rams into the future and extrapolates disasters. I'll never recover from this. My life is ruined. It will always feel this way. That's not true. That's the cortisol talking, not reality. Your only job in crisis is today, not the next month, not the next year. Don't think about that. What you need to get through today sometimes is even smaller. The third one, protect your physiology. I know this can feel impossible when you are in crisis, but hear me out. Your nervous system will not stabilize if your body is collapsing. That means sleep. Even imperfect sleep, even with support, this is non-negotiable. Food, not perfectly, just something little. The brain needs glucose to regulate emotion, movement, not a marathon, a walk, even 10 minutes. It metabolizes cortisol, limit alcohol. I know it feels sometimes like a relief, but it's not. Alcohol disrupt sleep, destabilize mood, and extends the crisis. The fourth element, reach for connection, the right kind. Not everyone around you will know how to help, and that's okay. What you need in crisis is presence, not solutions. Someone who can sit with you in the discomfort without trying to fix it or even minimize it. If you don't have that person right now, a therapist can serve this function. A crisis line, even a support group. Isolation in crisis is dangerous. The brain interprets social disconnection as additional threat. It compounds everything. The fifth one, watch the trajectory. This is the one I most want you to remember. Give yourself a reasonable window, 2 to 3 weeks, and honestly assess, I am moving, even slightly. If the answer is no, or if the answer is I'm getting worse, that's your signal to seek professional help. Not because you fail, because you have moved into a situation that requires a different kind of support. The last one, know the red flags. If you or someone you know is experiencing ideas of suicide or self-harm, inability to care for themselves, not eating for days, not leaving the bed, the loss of contact with reality, things that don't make sense, seeing or hearing films, talking films, believing in real films, threatening harm to others. A sudden, dramatic calm after a period of severe crisis. Sometimes these signals a dangerous decision has been made. These are psychiatric emergencies. They are not weakness. They are medical situations. They are medical conditions. I want to leave you with something I tell my patients. A crisis is loud and is painful and it disrupts everything, but it's also always information. It's telling you that something in your life or inside you needed attention that it was not getting. Maybe it's a relationship that had been hurting you for longer than you admitted. Maybe it's a pace of life that was never sustainable. Maybe it's a grief you bypassed. Maybe it's the first sign that your mental health needs care you didn't know it needed. None of that makes the crisis good, but it makes it meaningful. The people I have watched recover most fully from crisis, whether situational or clinical, are not the ones who got through it fastest. They are the ones who let it teach them something. If you are in crisis right now, I want you to hear this. Let me highlight this. You are not weak. You are not broken. You are overwhelmed. And overwhelmed is survivable. Get support. I'm Dr. Katia Batista, psychiatrist. If this video helped you, share it because someone in your life might need to hear this today. Subscribe to this channel if you want more content that takes psychiatry seriously without making it feel scary. And leave me a comment. Tell me, have you ever been through a crisis that taught you something about yourself? I would like to hear it. Take care of yourself. See you in the next one. Thank you.